roof of the intestine twists around itself, right? Or the, or its mesentery. So it is going to do what? It is going to, lead to the bowel obstruction. And if there is a bowel obstruction, then the symptoms with the patient will come to you with the abdominal pain, vomiting, bloating, constipation, okay? Or sometimes the bloody stool. And you see, and its remedies that we are going for the surgical intervention, okay? We're just going to do the laparotomies, and then we have to take that volvulus out of its place, because sometimes if this volvulus is so severe that it is going to lead to the जैसे the loop will be twist on itself or the around the mesentery, तो क्या होगा? Its blood supply will be compromised, and if blood supply is compromised तो क्या होगा? There will be the gangrene, ठीक है? वहाँ पे ना blood supply compromise हो जाएगी तो there will be the gangrene, and that will lead to the perforation and lead to the peritonitis, right? So it's an emergency, surgical emergency, and we are going to we are just going to do the laparotomies, ठीक है? For the we just go for the surgical intervention, ठीक है जी? Similarly, there is another condition that is called as a intussusception. Intussusception, which it is basically, you can see this is a condition where this is sigmoid volvulus, ठीक है ना? कि यहाँ पे because sigmoid volvulus is most mobile part of the large intestine, so it is going to twist on itself, as you can see, and after twisting, its blood supply is being compromised, and you can see this discoloration. It is going to represent the gangrene of the loop of the sigmoid column. फिर हम क्या करते हैं? We are just going to cut it down from here, and we are going to make the end-to-end anastomosis between the viable part of the gut. ठीक है जी? Is it clear? Okay. Now the intussusception. Intussusception, beta, here you can see over here. It's a condition basically in which a proximal part of the intestine, you see the proximal part of the intestine, it is going to fold on the distal part. अभी देखें, it is the proximal part is going to fold over the distal part or the next part of the loop of the intestine, right? And of course, जब ऐसा होगा तो क्या होगा? Again, it will lead to the compromised blood supply, and again, it's an emergency which needs the surgical intervention. Here you can see this one. ठीक है जी? ये proximal intestine है जी, and it is just going to fold inside to the distal part. You can see. यहाँ पे when it's going to enter over here, तो यहाँ पे होगा, there will be the obstruction. ठीक है? Obstruction के बाद there is a blood supply will be compromised, and that will lead to the surgical emergency. Okay जी. ये तो आपकी surgical कुछ conditions हैं जी. There are certain other conditions, the medical conditions, like the irritable bowel syndrome. ठीक है जी? Irritable bowel syndrome. It is basically the disorder of the large intestine basically, and the patient comes to you with the complaints of the constipation, diarrhea, cramps, abdominal pain, gas, and the bloating, right? And all with these complaints, you see, the one thing which is different, that इसमें कोई inflammatory sign नहीं होता जी, ठीक है जी? Irritable bowel syndrome, right? And इसकी जो causes हैं, they are just like the oversensitive colon हो सकता है, post infection cases, or bacterial infection हुई है उसके बाद जो post infection cases that will due to the post infection by the of the bacterial infection, उसके बाद bacterial overgrowth, right? So this is a condition that can lead to the patient came with the history of the alternate constipation and diarrhea, ठीक है? उस कंप्लेंट के साथ होता है, right? अच्छा, उसके अलावा the irritable bowel syndrome के अलावा there is a condition that is called as the irritable bowel disorder or the disease, और ये जो है ना, that is associated with inflammation, ठीक है? इसमें आपको inflammation pattern नजर आता है, ठीक है? वो कैसे आता है कि there are the two conditions. There is one is the ulcerative colitis, आपने सुना होगा, ठीक है? The other one is the Crohn's disease. So ulcerative colitis is basically a long-lasting inflammation, ठीक है? And when you're just going to observe it, so you can see the lot of small ulcers which are present in the mucosa of the large intestine, ठीक है ना? They are going to affect the innermost lining or the mucosa of the large intestine and the rectum. Whereas in the Crohn's disease क्या होगा जी? Crohn's disease में here So here you can see the Crohn's disease. Crohn's disease में बच्चे we have got the again the complaints like the diarrhea, fatigue, weight loss, malnutrition. तो इसमें एक generalized किस्म की जो है ना Crohn's disease actually differ करती है ulcerative colitis because it has the generalized condition or generalized sort of the conditions or complaints का patient आता है. OSP cause it is not known. It's idiopathic, but it is again occur in the patient with the leukemias can present with that one. Hereditary causes, hereditary भी हो सकती है और and it is most important that malfunctioning immune system. ठीक है. So जब immune system malfunctioning होगा तो क्या होगा बेटा? The patient will be coming for different complaints. ठीक है ना? क्योंकि immune system compromised हो जाएगा. So for Crohn's disease again having the complaints with the abdominal pain, diarrhea, fatigue, weight loss. Right. So these are certain clinical conditions which will be coming across. Okay. There is another condition. But इसमें आप ये देखें, इसमें जो intestinal wall है, it is going to become thickened, right? And it has got this cobblestone appearance of the surface, right? Okay. और यहाँ पे आप देखें कि ulcerative colitis में ऐसा ना कि some part of the one part of the small intestine, sorry, large intestine is going to have the inflammation in some part. Okay, but over here in the Crohn's, you can see the multiple spots in the involving small intestine, large intestine, right? So it's going to involve the multiple parts of small, large intestine. Okay, there is another condition that is called as the along this small intestine at the near the icical junction, you are going to come across with a congenital anomaly that is called as the MECKEL'S diverticulum. I have told you the diverticulum क्या होता है? What is the diverticulum? The blind tube-like structure extending from the some cavity. ठीक है? ऐसे ही मैंने बताया था ना, right? So this is the MECKEL'S diverticulum and it's a common congenital anomaly of small intestine, right? And it is basically caused by the incomplete obliteration of the white line duct. ठीक है ना? White line आपने इसकी development पढ़ी है ना small intestine की. So incomplete occlusion, obliteration of the white line duct would lead to the presence of this small diverticulum worm-like structure over here at the lower part of the small intestine, and that is called as the MECKEL'S diverticulum. Okay. इसके अलावा बेटे there is a condition that is called as the diverticulitis or the diverticulosis. What is basically diverticulosis? Basically, diverticulosis beta or diverticulus are basically the small pouches are formed. You can see these small pouches. These are formed in the wall of the intestines. ठीक है? Commonly the large intestine. Small pouches बन जाती हैं walls of small intestine. That is called as the diverticulum. And if they are much more, and this small pouches is called as the diverticulosis. If there is inflammation of these, pouches takes place, that is called as a diverticulitis, right? So that diverticulosis is basically causes में क्या होगा जी? इस causes में old age हो सकती है, age, ठीक है? Because with the age, the walls of the intestine they become weak and they can lead to the formation of these pouches, ठीक है जी? Or dietary habits, so because we are not going to take much fiber, so just give say the walls of the bowel they can be affected, right? But number third, you can see the genetically, some person it runs in certain families, this diverticulosis, right? So these are the certain clinical conditions you must be coming across, and you must be knowing all these things. ठीक है जी? Is it clear? जी problem तो नहीं है conditions में. It's just a brief introduction just to give you the these are the certain terms which you must be coming across in your routine, life nowadays also. ठीक है ना? So you must be familiar with these terms which are related or the clinical conditions which are most commonly present in our society. Okay जी. यहाँ तक सब clear है जी? Everything is clear?
Yes, sir.
Okay जी. Okay, I'm going to